Hello friends, welcome back to All on Law. In this video lecture, I will talk about the clinical importance of CBC. So it's called as a complete blood count. So as you are aware that complete blood count is a blood test, so which helps us to know the problem with the patient, to know the diagnosis. So I'm not going to talk in detail. I will just tell you briefly. If you get a CBC report with you and clinically you have seen the patient, how you should proceed and what are the things that you need to look. So before starting this, please do subscribe to our channel All on Law, and please do share our videos on YouTube. So friends, let's start. And CBC, so you know that in the CBC a lot of parameters we do get, and in that are, first I will put like this. Here I will put HB, that is hemoglobin. Okay, then I will put total count, so I will be writing TC, and then I will put platelet P. I will put as a platelet count, which is very important, and this is for lymphocytes, and eosinophils are really very important. Okay, so this is gonna be, sorry, this is gonna, I'm gonna put this as a polymorphs, PO, and next platelets I will put as a platelet count as a PC. So platelet. Okay, so here I will put the disease, the what disease we are thinking of. Okay, so let's proceed and see if you get any what you call the CBC report with you, a blood count report, just you see these things. Now let's talk about one case scenario. Remember, there are a lot of parameters in the CBC like MCV and RDW, all those things, so many things you will be getting, but that will help you in detail. But you, for that you need peripheral smear and further more tests, serum ferritin levels, transferrin levels, or many things that you require to tell exactly. But in, if you are sitting in a OPD and you want to know and you want to treat the patient, then what do you need actually? So let's talk about this one case scenario. I will change the color of this okay, let it be. I think it will take time. So let's start here, and I will tell you, one is the HB. Let's keep as a normal. So you should be knowing the normal level of HB, all those parameters. So, and the total count has increased, so I will put has increased a lot. Normal total count is 4,000 to 11,000. Sometimes it says 10,000, so it depends. Okay, so 11,000 you can take cutoff, sometimes 12,000 also. So, and the polymorph also increased, so polymorphs also increased. Lymphocytes not increased, normal, or just you can say low. Okay, a little bit low. Eosinophils, you don't find eosinophils, and the platelet count is normal. So look, the HB is normal, it means there is no anemia. Okay, so the total count has increased, so possibilities could be viral infection, yes, bacterial infection, systemic infection, it could be tuberculosis. Okay, so it could be typhoid also, enteric fever. So what you have to see is the total count over here has increased a lot, maybe 16,000, 20,000, somewhere around, and the polymorphs also increased, and lymphocytes have decreased. So lymphocyte indicates most of the time it indicates acute viral infection, but it does not mean that every time it indicates acute viral infection. So looking at these, platelet counts have been normal. So if platelet counts comes low, then it indicates a viral disease. So there is a fight between acute bacterial infection versus acute viral infection. So being the platelets very important over here, that's normal, it means it's a acute bacterial infection, ABI I will put. Okay, so this is really very important, remember. So let me change the color now. Let's proceed to another color. Okay, so next patient we will take. So in HB, another HB is normal. Okay, and the total count is again increased. Now you, if you see the other patient, if you compare with the other patient, then you will come to know that exactly how we are proceeding with. And the polymorphs are increased. Okay, and the lymphocytes are low again. The eosinophils are normal. Look, the eosinophils are normal, okay, and the platelet count is high. So now, when the platelet counts are very high, remember there is only one disease that can cause like this. So looking at the platelet counts, the disease will be systemic inflammatory disease. Systemic inflammatory disease. It could be Kawasaki, it could be some what do you call it, inflammatory, any kind of inflammatory disease, arthritis, rheumatoid arthritis, or any good. So systemic inflammatory disease. What we saw over here is a high platelet count, but in the first case scenario, the platelet count was normal and the eosinophil was 0. In bacterial infection, eosinophil count will be 0. There are other conditions where you find eosinophil count 0. Let me change the color and proceed to the another what you call the case scenario. So these are very important that you should be seeing and proceeding with. Okay, let's right. So now let's see. Now again the HB is normal and the plate and the total count is a slight high, maybe around 14,000 13,000, okay, not very high, and the polymorphs are increased, whereas the lymphocytes again are low, or you can say there's no much difference. The eosinophil count is going to be 0, okay, and the platelet count is low. So look at this. The platelet count is residing between the acute bacterial infection, systemic inflammatory disease, and another one condition where you find a low platelet count. Very good example is a dengue. So it's gonna be viral infection or any viral infection. Acute viral infections. Okay, it's gonna be viral. So acute viral infections. So now let's move on to the other condition. Okay, so this is how here you saw that the important thing over here was actually the platelet count has decided. Okay, eosinophil count was low, remember, it means 0. Now let's move on to another condition where the HB is normal, okay, but you see the total count has decreased. Okay, the total count has decreased, less than 4,000 it could be, okay, and the polymorphs are not affected, and the lymphocytes is high, and the eosinophils are 0. And now the important thing is a platelet count, which is again a low. Now here what you need to see is the total count has decreased. Though the child or a patient has an infection, the total count is low. It could be a viral also sometimes, but look here, the total count has decreased and the platelet count has decreased. Eosinophils is 0 and the polymorphs are not so much high. Then it indicates that the most common gonna be typhoid fevers. Yes, enteric fever. Typhoid fever, right? So this is how you should clinically you should see and make a difference between the patients, and you can treat accordingly. Now let me take another example where it will be very bit confusing. The HB is normal, okay, and the total count is slightly increased, maybe 13,000 somewhere around, and the polymorphs are not affected. And if you talk about the lymphocytes have increased, okay, and eosinophils are what you call the are normal, or it could be slightly high, and another one important is the platelet count, which is a normal. Now look, the child or a patient has a fever, the total count is just slightly high, lymphocytes are high, eosinophils are normal, or what do you call, or slightly high, but the platelet count is normal. It could be two possibilities. It indicates a chronic infection, so it could be a tuberculosis, TB, or it could be a chronic infection. Chronic infections, remember, okay? So this is how clinically you can see. So if you read each parameter, if you read CBC like this, and it requires a practice actually. If you are very well, then definitely you will catch in minutes, in seconds you can say. Now let me move on to another one example where HB is low. HB is low, or HB has decreased. Remember, now HB is decreased. Total count may be increased, or it could be what you call decreased. Polymorphs may be increased or decreased. Okay, and the lymphocytes may be increased or decreased, whatever. Now HB is really very important. Remember, sorry, this could be low. Okay, and the eosinophils over here, you see, is either it could be normal or it could be what you call elevated. Okay, and if you talk about the platelet count, which is going to be low, now this is really very important. Low HB with a low platelet, indicates, remember, it's nothing but malaria. Okay, so this is how very important. If the patient is sick and you are looking for a CBC, and then you find what you call the reports, and you have to read reports very fast. So like this, another one example I will give you where you will find HB very low. Okay, and the plate total counts are very increased, like 25,000, maybe around 25,000. Polymorphs are maybe normal or somewhere. Lymphocytes have increased a lot. Lymphocytes have increased a lot. Okay, I will increase. Okay, increase a lot. So you are getting an example. I think you are getting that disease in your mind. So eosinophils is normal. Remember, eosinophil is normal, and the platelet counts are low. So this indicates with a very high total count, platelets being a low, either it could be a acute viral infection, but the total count will be total count will be in the 1,000, 25,000, somewhere around 35,000 also, but the lymphocytes will be very high. In viral infection it will not be so high, but here you see very high. And eosinophils will be zero in case of acute viral infection, but in case of this disease, that is ALL, acute lymphocytic leukemia, very important. Okay, so this is how you should interpret the CBC based on HB, total count, polymorphs, lymphocytes, eosinophils, and the platelet count. Okay guys, I hope you got an idea. So go through this once again, and please do subscribe, and if you like the video, please thumb up, and please do share our videos on YouTube. Okay guys, take care, bye.